know that some of this focus on primary care has made huge differences in the amount of number of hospital days that you've had for your members, and that's led to some decision to close some hospitals in the group health system. How do you think that translates to the larger healthcare system as a whole? Is that the direction that we'll be moving nationwide?
So within the group health system, we are seeing one of the outcomes from a system that's working well is lower hospital utilization on a per member basis. Ironically, I was hired 28 years ago to Group Health to run our hospitals, and in the subsequent years have systematically closed all of our hospitals, because as our utilization has come down, the cost per unit of service for these big fixed cost, regulated, capital intensive campuses continues to go up. And so we have systematically closed our hospitals based on the belief that if we can buy hospital days on a per diem basis through community hospitals and arrange that relationship in a single hospital that has capacity, that we can focus all of our attention where it matters most, on care for patients leading up to a hospital admission, on care for patients post-discharge, and do what we can to make sure that when we need to use hospitals, we use them very well. And what we found is, in fact, this has helped us continue to reduce our hospital utilization. It saved us an awful lot of costs. And in communities around us, it has used the unused capacity in community hospitals in a really smart, efficient way. My expectation is that the way in which we've gone through this change is going to offer tremendous insight into the industry more broadly, an industry that is going to have to go through very similar changes as well. Our hospital capacity in most communities around the country is way too high. And when you just look at some basic statistics, for the Medicare program in the state of Washington, hospital utilization per beneficiary is about 1,200 days. At Group Health, our Medicare utilization is about 850 days per thousand. Well, in Pennsylvania, it's 2,500 days per thousand. And the people who live in Pennsylvania aren't that much sicker than the people in Washington. There is a hospital utilization practice pattern that is going to have to change. You can't justify or explain or continue to pay for that kind of variation in hospital utilization.
All right. Well, thank you so much. It's been a pleasure.
Thank you. My pleasure too.